I'll be able to share with you 7 facts about breast cancer. I hope you'll learn at least one thing. But most importantly, I hope I will change some kind of behavior. I'll inspire you to change at least one thing. So as a disclaimer, this information is for health education only, so it's not used for diagnosis and treatment. So in terms of the facts, and some of these are a little bit scary, and I'm okay with scaring you if it means that I'm going to scare you to act. So the first one is that breast cancer is a very common cause of cancer in women. Now a lot of you know this, but maybe you don't know the extent of it. What we know, if you've heard this term before, 1 in 8. 1 in 8 women in their lifetime will develop breast cancer. So if you think of the women that are sitting next to you and you count off 8, 1 in 8 will. And the American Cancer Society estimates that about 227,000 new cases of breast cancer will be diagnosed by the end of this year. And about 39,500 women will die of this disease. So breast cancer is very common, and it affects us as women. The other thing is that all women are at risk for breast cancer. It doesn't matter your age. The truth is, the older you are, the greater the risk. But actually, there's about 5% of breast cancer that's found in women younger than 40. And that number, there's a higher incident in African American women. So we're all at risk. If you're a woman and you have breast, you're at risk. The third thing, and I've heard women say this before, they'll say, I don't need to practice breast self-exam and all of that. I don't have a family history of breast cancer. So this is partially correct. If you've had a family history of breast cancer, you have an increased risk of getting breast cancer. But the truth is, the vast majority of people who've been diagnosed never had a family history. 8 out of 9 women diagnosed with breast cancer never had a family history. So because you've never had a family history does not mean you should not protect yourself. There's also another 4th fact. There's a type of breast cancer called triple-negative breast cancer. I don't know if you've ever heard of this. Many years ago, I wrote an article for a newspaper on breast cancer. We didn't hear about this. 2 weeks ago, I wrote another article, and we've been talking about this a lot. Triple-negative breast cancer means that this breast cancer is very aggressive. It's hard to treat. Most breast cancer, when you look at the cells, they respond to estrogen, they respond to progesterone, or another protein called HER2, HER2. And what happens is when you know this, you know what you can give to treat it. So if a woman has breast cancer that is responsive to estrogen, you treat them and you can give them tamoxifen for several years. When you have triple-negative breast cancer, there's nothing to give you for several years. And so it is very important to be vigilant about catching this early because it is so aggressive. The 4th fact, and this one breaks my heart. It breaks my heart because, as I said, about 15 years ago when I wrote an article about breast cancer, this fact was there. 2 weeks ago when I wrote another article for the newspaper, this fact is still there. So white women are diagnosed with breast cancer more often than black women. Black women die of breast cancer more often than white women. And aside from genetics and aside from poor access to care, one of the reasons is that we show up at the party late. We show up when the lump is already so big and it's spread to other parts of our bodies. Other people are showing up when they feel something small or because they had a mammogram and they saw something. So it is so much easier to treat. We show up when it is so late and there's not much to do, and we have to do better at that. I think we have to care about ourselves more, to take preventative action so we are showing up when things can be treated. And so I've shared a lot of bad news. I have a couple of good news. My 6th fact is that although we don't know the cause of breast cancer, we really don't know why a normal breast cell becomes cancerous. There's some genetic mutation. You'll hear people say BRCA1 and BRCA2. It's a small percentage of breast cancer where it's passed on from generation to generation. That's not the vast majority. The vast majority of breast cancer, we don't know why it happens. What we know is that there are risk factors. Some of them we can change and some we can't. We can't change the fact that we're women. That puts us at high risk. 97% of breast cancer is in women. We can't change our age. The older we are, the greater the risk. We can't change our family history or any of that. But the other things they're finding is that when they look at women who tend to get breast cancer, they tend to be overweight. We don't know if when you have fat, or what they call adipose tissue, it gives off estrogen. And some breast cancer grow from estrogen, so we don't know if that's why. but they tend to be overweight. They tend not to exercise. They tend to eat the wrong things, very little fruits and vegetables, a lot of fats, and they tend to consume some alcohol. We can change all of those things. We have the power to change all of those things. If you don't exercise, you don't have to go to the gym, but you can walk. Get off the bus and walk. Take the stairs. You can walk. You should be eating, when you look at your plate these days, you should never see two colors, white and brown. It should never be meat and potatoes or meat and rice. You should see at least 4 different colors. You have to really care about yourself enough that you're eating enough fruits and vegetables, because fruits and vegetables are like medicine to your body. So you really have to watch what you're eating and exercise more. Decrease alcohol intake if you're taking in alcohol. And the 7th thing is, although a lot of people are diagnosed with breast cancer, a diagnosis is not a death sentence. There are about 2.5 million survivors of breast cancer today. But the key is that these people are generally diagnosed early. And the 3 things, and you guys already know this. I know you know it. We don't always do it, though. The 3 things we need to do to protect ourselves: monthly breast exam, and I have brochures out there how to do them, and if you don't know how, I'm not afraid to teach you. It's a monthly breast exam. Because how are you going to know if there's a change if you never examined your breast? If there's something new, you can't tell if it's new if you don't know what's there to begin with. And so you're looking for a lump that's usually hard, it's usually painless, and it's usually fixed. It doesn't move. Now, that being said, there was a coworker of mine who was diagnosed with breast cancer. She had a very painful lump. She assumed it was nothing, and it was breast cancer. So any kind of lump you want to report. You want to look for any changes on your breast. So you're looking for any puckering or dimpling, any changes in the skin. If the breast is red, we had a family member that was in the nursing home, and the breast was red, and they had been putting on ointment thinking it was a fungus, and that person had breast cancer. So for months, they were treating it like a fungus. So you really want to make sure that if there's any change, especially if it's on one breast, any change, the breast nipple turns inwards, there's any kind of discharge, you want to bring that to the attention of your provider. The other thing is you want to go in for an annual breast exam. This is where your doctor or your provider does an exam. It's another pair of hands that's looking around for a lump. And you should be going to your doctors once a year anyway. You should go to have your labs, your blood pressure checked. Get into the habit of proactive and preventative medicine. Don't just show up when things go wrong. And the 3rd thing is a mammogram, and I'll leave that up to you to decide with your provider. I know some people are very much against it, but one thing you should know is that mammograms show lumps before you can feel them. And then it's easier, much, much easier to treat. Right now, the American Cancer Society suggests a mammogram for women over 40 every 1 to 2 years, depending on their risk factors. That's something you want to discuss with your primary care provider. Okay. So, breast cancer is a common cause of cancer. It is something that I believe kills way too many women that look like me. I believe that there's a lot we can do to prevent this. We really have to jump on protecting ourselves by doing preventative breast health. I think we have the power to change the amount of women that die from breast cancer, but we have to be proactive about this. So I thank you for listening to me, and I wish you continued health. And please be safe with that storm. Thank you so much.